Healthcare distributors are working to increase COVID vaccine doses in Minnesota as states around the country work to get more Americans vaccinated. Matt DiLoretto is the vice president of Health Distributors Alliance. It's a national organization that's connecting those who make the vaccines and our local health officials who vaccinate the public. Matt, here in Minnesota, the distribution rollout has been a pretty bumpy road. So as far as you know, what's being done to increase the supplies, not just in Minnesota, but in states across the country?
Yeah, that's a great question, and it's certainly been a bumpy ride across the country for, well, I guess it's been almost 1 year now exactly since the whole nation has been facing this challenge. And there are a number of steps that are being taken by the federal government to increase supply and what we are calling shots in arms. And that involves both a commitment for increased supply on the manufacturing side, as well as expanding on the network of providers that are able to administer this vaccine. Where the Healthcare Distribution Alliance comes into play, our members are the logistics providers of the industry that ship those products that the manufacturer creates to those dispensing locations. And so far in Minnesota, we've shipped about 1.2 million doses.
Okay, so when I talk with our local county health officials, and they're the ones who are running these mass vaccination clinics, I get told that it's on the federal level, the federal level gets blamed for why we don't have enough doses. So does that mean you?
No, that does not mean us.
Okay.
We are the shippers of the product. The manufacturers are creating it, and HDA's one largest member, McKesson, which is one of the largest wholesale distributors in the country, has been identified as the centralized distributor for the federal government. We are shipping that product that the manufacturer is creating.
Okay,
So,
let me ask you this then. Last week's storm, I know in a lot of states, especially down in Texas and then some of our other southern states, is also one of the reasons why supplies are low starting this week. But we've been having a supply issue for weeks.
That's correct. That's correct. That is a supply issue. That is, you know, the whole pandemic has resulted in it's supply and demand. The manufacturers are manufacturing as much as they can, and that supply is supposed to increase, the Biden administration has said, by about 20%, which is a good thing. And the other factor that we are starting to see even out is the fact that the numbers of units shipped into the state and the administration, the shots in arms, those numbers are starting to come together a little more closely. So right now, as I said, the distributors distributed 1.2 million doses into Minnesota, and as of yesterday, 1.1 million have been administered. So there is still a delta there between the units actually getting into the state and those being administered. The numbers that are allocated to the state are driven by the federal government. That is also a common misconception. So it's not the typical supply chain where a provider location orders a vaccine and then we ship it. The federal government is allocating the number of doses for the state per state. So they are driving the numbers the state is getting.
There are other manufacturers, Johnson & Johnson being one of them, of vaccines that will be coming out once they get approval by the government. We also did a story yesterday on a company that is here in Rochester. Of course, you know Mayo Clinic is here. So we have a lot of companies that have been thinking about or moved their operations here. And one of these companies is coming out with an oral vaccine. And so as vaccines start coming out from other companies, we have to imagine, logistics tell us, that there will be more available then to the public. Where do you see things in the next month, 2 months? We're hoping to have a lot more people vaccinated, I know, by June.
Absolutely, absolutely. And like I said, I do see things already improving. That is not to say there's not still challenges out there, but if you would have looked at these numbers, a few weeks ago, as you were just kind of alluding to, that the numbers of those doses being distributed was much higher than the number of shots getting in arms. And we can use the national number for comparison. As of yesterday, 75 million doses were distributed to jurisdictions, to states, from our distributor members. And still, as of yesterday, there was only 64 million doses actually administered, according to the CDC. That's a 10 million dose differential between that is what is out there in the supply chain already shipped, and that is already getting in arms. So I think the steps that the government has taken to increase supply on the manufacturing side, to your point, the Johnson & Johnson products coming online, and plus, I think the biggest thing that is going to help is the additional administration sites that are being stood up as we speak. These are all good things, and I think they are going to result in additional shots getting in arms.
Well, speaking to you gives me a renewed hope, because we have been talking about the confusion with the vaccine, the delays, and the supply and demand issues that have plagued a lot of states over the last month. So it's nice to get some good news. Hopefully we will see some turnaround in the next month or so. Matt, I appreciate your time.